Parents might be confused about what's best for their kids after the WHO's chief scientist issued guidance that conflicts with the CDC's own guidance for kids ages 12 and older. Here's a soundbite from the WHO.
The aim is to protect the most vulnerable, to protect those at highest risk of severe disease and dying. Those are our elderly populations, the immunocompromised, people with underlying conditions, but also healthcare workers. There's no evidence right now that healthy children or healthy adolescents need boosters. No evidence at all.
That's Dr. Suma Swaminathan saying children and teenagers, no evidence that they would need booster shots right now. However, earlier this month, the CDC did recommend booster vaccines for kids ages 12 and up. This followed the FDA's approval of Pfizer's booster for that very age group there. All right, joining us now to discuss is cardiologist and author of the book, What Your Doctor Can't or Won't Tell You, Dr. Evan Levine. Doctor, welcome back to National Report. Thanks for coming on today. We just want to clear things up for maybe some parents who are trying to make the best decision to keep their families healthy. What do you tell them?
Well, let's not forget the WHO is looking out for the world, and they're concerned about countries hoarding the vaccine. One group I think we should really focus on are the young boys and the young men who have the highest risk of myocarditis. Now, 90% of the cases of myocarditis are seen in young men, young boys. And of that, 90% of those cases occur after the second shot. So the fear is, especially in those low-risk young men, why give them a booster when it's very suspicious that they'll have a higher risk of myocarditis than COVID themselves? I think it's an individual answer that the parents and the children have to come to an agreement about. No child should have this mandated that they must accept a booster vaccine. They're already at a very low risk. And as I mentioned, young boys will get myocarditis and possibly at a greater risk than of COVID. So I don't believe we should mandate boosters in children. I am concerned, and I do agree with the WHO, that we need to vaccinate the entire world. And why give boosters to low risk people?
Yeah, you definitely raised an important point. There have been reports of instances of myocarditis in these young boys here. So again, as you recommend, talk to your doctor. Get that individual advice to find what's best for you and your kids' health, of course. Let's switch gears, though, talk to you about some news that came from the Biden administration just yesterday. They're launching a sort of database where you can request some free at-home tests. They say they might arrive between 7 to 10 days after you can submit it. You're going to get this to your household again. You just type in your address and they should ship, in theory, to you. This also comes along with the headline here. The U.S. is going to make 400 million free N95 masks. They aim to have these available at local health centers and retail pharmacies as well. Based on what you've seen when it comes to Omicron, how long do you think we'll continue to see sort of this increase in surge of cases? And with the masks, with the tests available here, will that help bring these numbers down?
Well, again, if we look at the data in South Africa, there's a very rapid decrease in the amount of cases, just as rapid as that increase. Now, as far as these home kits are concerned, I jokingly call it Operation Sloth Speed. So we're going to get these kits probably after the peak of the Omicron variant, after everyone waited in lines for weeks and weeks. And I want to compare this with the entitled people out there, like our Native American Senator Elizabeth Warren, who announced on Twitter December 19th, I'm going to quote her, "I regularly test for COVID. And while I regularly test negative early this week, today I tested positive." And that really troubled me. That's her, it's her Marie Antoinette moment. What about the teachers and the bus drivers and the nurses and the medical assistants and the housekeepers and the phlebotomists and doctors and transporters who work in the hospital, take a real risk every day and go to work, and they may be asymptomatic and infect people. And they're going to get a box of 4 kits. And if they have a family of 5, they may have to pick straws to see who gets the test. And then again, they only have one test. But Elizabeth Warren tests regularly because she's entitled, and she's more important than the teachers and the bus drivers, and everyone in that hospital takes a risk every single day. And for me, that's the point of this. These tests are coming way too late. We're not getting enough of them, and the entitled people already have them. I'm not so sure how this is going to help us. And it really, really troubled me to hear about these entitled people and, let the rest eat cake and get a test of 4 for a household of 5.
Yeah, and it might come in 12 days. Thank you for sharing your perspective. Dr. Evan Levine, we do appreciate it.